YOLO Cares. And we'll talk a little bit about basic pain management today, but before that I'll just talk a little bit about YOLO Cares. So we'll go through the slides here and how to make a referral as well if you're interested in that. So YOLO Cares is a nonprofit hospice organization caring for people who have a life-limiting illness. So we offer a wide variety of supportive care services from our Galileo Place adult day facility to the Joint Commission accredited hospice and palliative care programs. So this is just a little snippet of our referral page and how to make a referral to YOLO Cares. And so if you feel like your loved one could use some individualized and compassionate care and that something that aligns with their wishes and they're coming to the end of life, please feel free to call our offices at that number shown there to learn a little bit more about YOLO Cares and the services that we provide. And if it's something that you are interested in or your loved one is interested in, your physician can go ahead and fill out that PDF form that we have on that Make a Referral page, and we can get you started. And then after that, of what to expect. Once our patient access team receives your loved one's referral, they'll be able to contact you to gather more information about your loved one and to schedule an admission visit with our skilled admissions team at the current residence of the person who needs that care. All right, and so we'll get started on our basic pain management class. Again, my name is Monica Chander. I'm the clinical nurse educator at YOLO Cares. And our learning objectives include 1, to define pain and the difference between acute and chronic pain. Number 2, to identify nonverbal symptoms of pain. Number 3, to assign pain a numerical score based on a variety of tools. Number 4, understand the principles of basic pain management. And 5, to identify non-pharmacological techniques for pain management. So what is pain? Well, pain is a universal phenomenon. Everyone feels pain. And everyone knows what pain is, and we've all experienced it at some point or another. And pain is also the most common reason people seek healthcare. So for example, if you're having radiating chest pain or arm pain or chest pain, then you might want to call the ambulance or go to the ER to have a visit because it might be a heart attack. It might be associated with a heart attack. And also many diseases and illnesses are discovered because a patient is in pain. So let's say you feel a bump on your neck one day, and in the next couple of days, it starts to become painful and unbearable. So you may want to go to the doctor and get that checked out. Sometimes it's nothing at all. Sometimes it can be a little bit more malignant. And so it could be something like a cancer tumor, but it's good to get that checked out early. And so pain is defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. And pain is always subjective, so everyone experiences pain in different ways. And an individual's pain threshold can also be different. So if someone is having a migraine at a level of 2, for example, another individual with a similar type of pain could have a threshold, could have a pain level of 5 because their threshold for pain is a little bit lower, so they feel that pain a little bit more intensely. And pain is whatever someone says it is. So if someone says that the pain in their chest feels like there's an elephant sitting on there, which is very improbable. They've probably never had an elephant sit on their chest before, but the clinician still needs to report that and will report that because that's what the patient is feeling, and the pain management will go from there. So pain is actually pretty poorly understood, and why do you think that is? Well, we'll go over that next. So why is pain misunderstood? Well, for one, there is no definitive test. Pain is subjective to the individual, like we discussed, which means that there's no clear-cut objective test to measure it. So when someone reports pain, people have to make assumptions about how that person is feeling. And also it's invisible. So unless the pain is from like an injury or a cut or a burn, something like that, it's pretty invisible. And the only person that truly understands that pain is the person experiencing it. Pain is also inconsistent. So people who experience pain, especially chronic pain, which we'll go over later, people have good days and bad days with that. And lastly, pain has no known cause. So for example, fibromyalgia, which involves widespread pain, has no true root cause. And one theory is that there's one theory that is understood that people who experience trauma in childhood may have a different brain chemistry when in adulthood that causes their brain to perceive that pain a little bit differently, maybe more intensely. And because pain is misunderstood, all of this can lead to failed treatments, because sometimes healthcare practitioners themselves don't understand pain fully and don't know exactly how to treat it. And that's why sometimes there's a trial and error when you're talking to your doctor about pain management. So some facts about pain that we have. Everyone's response to pain is different. Again, pain is subjective. It's important to remember. And analgesics, which are pain medications, will work for one person, but not for another person. Or that person may need a stronger dose or a higher frequency, or they need it more often. And the causes of pain, how and why pain happens, are not completely understood as well. So overall, pain is quite a mystery. And so what is acute pain? You may have heard that in the past. Well, acute pain is temporary and short in duration. So it can indicate to us that there has been some physical damage done to the body and that you need to get away from that painful situation as soon as possible and seek help. And it's also protective in nature, believe it or not. So for example, if you have a cut on your body, that may indicate to you that you need to take a little bit extra care of yourself and that cut. Maybe you need to clean it more often, put some special ointment on there that may be prescribed by your doctor, and then bandage it up, etc. All right. And then also, acute pain is typically caused by an accident, injury, or an onset of an illness. And so, for example, if you have a sprain in your foot or a muscle ache in your back. And acute pain will often, but not always, respond to treatment, at least a little easier than chronic pain, and we'll go over that next. So what is chronic pain? Well, chronic pain is pain that persists for a longer than a reasonable and expected time. And again, you might want to remember that pain is subjective, and so what's reasonable for one person may not be for another individual. They may have a different reasonable and expected time frame. It's also not protective like acute pain is, so it doesn't appear to have any purpose, unfortunately, other than to cause persistent discomfort. And chronic pain can be caused by chronic conditions or sometimes by an acute injury or illness that persists. So it's pain that doesn't go away after treatment or even recovery. And some examples of this include cancer, a broken leg, or joint issues such as rheumatoid arthritis, which is an autoimmune disorder that causes inflammation between the joints, or osteoarthritis, and that's when the protective cartilage between the bones erodes away slowly or disappears, and the bones rub against one another, and that causes a lot of pain, as you can imagine. And lastly, chronic pain often does not respond to many treatments or requires constant changes in medication regimen to continue to be effective. And next, we'll go ahead and talk about cancer pain. And one thing to remember here is that actually not all cancer patients have pain. They may have other symptoms like nausea, hair loss, etc., but they don't all experience pain. But for those cancer patients that do have pain, they could have a combination of acute, chronic, and what's called breakthrough pain. Breakthrough pain is when a patient experiences a sudden flare-up of pain that is more intense than chronic pain. And that usually requires a little bit more intervention than what is used to treat and manage chronic pain. And I actually used to work in the hospital as an oncology and chemotherapy RN, and Most, if not all, of the cancer patients there were on some sort of treatment for pain, whether they were in the hospital or they went home. And that's because we want to be able to control that pain before it becomes out of control, because then it's hard to get back into that normal or that acceptable pain level for that individual patient. And so next here we see that we have factors that influence pain, and the first one is genetics. So an individual's pain tolerance and reaction to pain may be genetically determined. The next is age. So age can affect how someone reacts to pain and how he or she also reports pain. So for example, if you think about an infant or toddler, they're very young, they maybe never experienced a certain level of pain, and they're not able to easily verbalize that pain, and that can make that pain more intense for them. Whereas we have an older adult who has a similar, maybe a different type of pain, but they don't want to admit or report that pain. And as a good rule of thumb, as I just mentioned, it's always good to report pain early or to treat pain early before it becomes out of control. Next, for factors that influence pain is culture. So the expression and expectation of a patient in pain can vary widely from culture to culture. So some cultural groups value an extravagant display of emotion when they're in pain. You might see them crying or yelling, where others may value stoicism or not expressing any type of feelings. And next is causes of pain. So if you think about it, it depends on the injury that you have. So if you have a paper cut versus like a spinal injury that you got from a car accident, it's going to influence the type of pain you have. And then lastly, we have acute versus chronic pain, which we discussed. And chronic pain is more likely to develop emotional and psychological issues because the person that's experiencing that chronic pain is consistently experiencing it, and it may seem like there's no end in sight, which can be a problem in the future. All right, and some people may be unwilling to admit to feeling pain, and that may be because they have a belief that pain with aging or disease is to be expected or normal and it can't be managed. So they ignore that pain and don't report it to, for example, their caregiver or their family or their doctor. Another factors that influence pain is, and they may not want to admit to feeling pain, is because they have a concern that it's not acceptable to show pain or to take medication. So for example, we talked about different cultures. They may want to restrain from showing that feeling. Or we have males versus females. So sometimes males don't want to show that they have any sort of pain or don't want to show that emotion, whereas females may be more willing to share that. And then next we have dementia and speech problems that can make it difficult to describe pain. So that one's a very difficult one to control, but we'll go over how to kind of put pain on a scale in the next, with nonverbal indicators in the next few slides here. And next we have that there may be a fear of addiction and overdose. So maybe they've experienced this problem before and they don't want to go down that route of taking pain medication. Or they've experienced it in their family, and so they're afraid of going down that route as well. And lastly, it's more of a tip for caregivers. Caregivers can consider using the word discomfort instead of pain, because discomfort may be less of a poignant word to some folks, and they could then be able to express themselves and express that pain level that they may have. All right, so next we'll go over some pain scales. The first couple are going to be the verbal pain scales, and then the next two we'll talk about right after. So this one here shown on the screen is a numerical scale. And so as you can see, 0 would indicate no pain, 5 would be moderate pain, and 10 is the worst possible pain that you've ever felt. And you've probably seen this in the doctor's office or been asked to rate your pain on a level of 0 to 10 many times before. And the next one we have, you may have seen this as well, is the Wong-Baker-Faces pain rating scale. And so this actually originally was created for children, which makes sense with the colorfulness and the pictures, to help them communicate their pain. Now the scale is actually used for ages 3 and up, to help facilitate that communication of pain and to improve assessment as well. And so the appropriate pain management can be taken. And also this scale can be great for different ethnic groups who maybe don't speak English or the English is their second language, because as you can see, they may be able to point out what they're feeling, but just by pointing at the picture and display what they're feeling at that moment. All right, and the next couple we have here a nonverbal pain scale. So the first one we have is the FLAC scale, or FLACC, and this stands for face, legs, activity, cry, and consolability. And FLAC is a behavioral pain assessment scale used for nonverbal patients who are unable to self-report their level of pain. And this may be a good idea to use for people who have mild to severe cognitive impairment. So here we have the categories face, so maybe they're smiling or they don't have any expression, maybe they're grimacing or they're frowning or clenched. Legs is the next category, so they're normal, are they restless, are they rigid? What's their activity? Are they lying quietly or are they squirming and shifting, or are they jerking? And we have next categories, cry. Are they not crying? Are they moaning? Are they crying steadily? And last one is consolability. So how easily are they able to be comforted or relaxed? And this scale is also used 0 to 10. So 0 is no pain, 10 is the most severe pain. And each category is scored at 0 to 2. All right. And the next one we have is the pain ad scale. And so that stands for pain assessment in advanced dementia. And so this is kind of the same type. So we have a score of 0 to 10, 0 again being no pain, 10 being the most intense pain. And each category is scored 0 to 2. And so this might be a reliable assessment tool for patients who have advanced dementia and can't verbally communicate their level of pain. And the categories include breathing. So are they breathing normally? Do they have labored breathing or heavy breathing? We have negative vocalization, so they have none, or do they have some moaning? Do they have any loud groaning? Facial expression, are they relaxed or smiling? Are they sad? Are they grimacing? Next we have body language. Are they relaxed, tense, or rigid? And last again is consolability, so how easily are they able to be comforted? So with all of these pain scales, how do we then evaluate pain? So first we want to ask, is the patient able to express his or her needs? So that'll indicate to us which scale we should be using, like we just had reviewed a few minutes prior. So if they are able to express their needs, we can use the verbal pain scale. If they cannot, then we'd use a nonverbal pain scales. And so if the answer is yes, you may want to ask, are you experiencing any type of pain or discomfort? And based on the results from the pain scale, and also based on the doctor's orders and the patient's care plan, we can then proceed with pain management. And I'm just gonna skip over this here, this activity. And so when we're evaluating pain, there are some questions that we can ask others to get as much information as possible. And so these questions may include, where is your pain? Or when did the pain start? How long does it last? Does it come and go, or is it more constant? Is the pain sharp, stabbing, or dull? And what makes it better and what makes it worse? I'm going to skip over this as well. And we'll go to the next slide. And we have some nonverbal signs of pain. And this, again, may be helpful for patients who experience, who cannot express themselves, and their level of pain. So things to watch out for will be sweating, restlessness, or jerking, shifting or writhing in bed. Do they have any facial grimacing or frowning? Do they appear tense or rigid? Are they guarding some area of the body? Are they crying? That's always a good indicator that something is wrong. Are they drawing up their legs and knees? Do they have a low appetite? Are they sleeping more or are they sleeping less? Are they more confused than they're normal? And are they withdrawn? And there are times when pain cannot be 100% controlled. And this is kind of when the nurse will collaborate with the patient, or the caregiver will collaborate with the patient and family to discuss realistic goals and what would be an acceptable pain level. So we often ask this question a lot in the hospital, and you may have heard it in the past as well, about what is your acceptable pain level on a scale of 0 to 10. Because sometimes, again, pain cannot be 100% eradicated or controlled or relieved. But we still want the pain to be controlled to some extent, and we want to ask our patient what their goal is, what their acceptable pain level goal is. So next we'll talk about how to manage pain. So how do we manage pain? Well, you may have guessed pain medications is one of them, one way to manage. And we have, of course, our non-opioid, so over-the-counter medications such as Tylenol or acetaminophen. We have Advil, your ibuprofen or Motrin. And then we have our opioids that are prescribed by your physician, such as morphine or Dilaudid. And there are also non-pharmacological interventions that you can use on your own, and that includes, for example, range of motion exercises. Maybe your physical therapist might be one to be showing you that, or even your doctor to kind of relieve some muscle aches, for example, or muscle tension. Deep breathing. Deep breathing really helps with pain, and it also helps with de-stressing if you breathe in through the nose and out through the mouth. Distraction, maybe distracting yourself or your loved one. Heat or cold therapy, if you have a heat pack or an ice pack. Music is always a good relaxing choice, and acupuncture is also an option. And the goal here is to control pain, not wait until it gets worse. And a little more note on pain medication. So pain medications are an effective and powerful way to manage pain, especially when the pain cannot be controlled by non-pharmacological interventions. And it's important that pain medications are given on schedule based on the orders of your physician. So it's important to stay compliant. You may have heard that word in the past, if nothing else but for your patient safety or your safety. Because issues of overdose and underdose are both issues in pain management. And if you observe that your patient is in pain, or you are yourself are in pain, you want to remind yourself or your patient to administer the pain medication, because sometimes people can forget when they can take pain medication. And that's why it's good to review with the doctor's orders of when that can be taken, and to keep on top of that pain management so it doesn't get out of control. And also a little note on side effects from pain medications. We want to be aware of the potential side effects of pain medications. It's always a good idea to review your pain medications again regularly, either with yourself or your loved one, maybe your caregiver or a nurse. And of course, when you start a new medication, you should discuss possible side effects with your physician and of course your pharmacist. And it's always good to know what you're putting inside your body, no matter what, if you're eating something, or if it's, of course, like a pain medication, especially when it's prescribed. And you want to notify your caregiver, nurse, or physician right away if you observe any of the following here. So if you're having excessive drowsiness, a slowing of breathing, dizziness, constipation, or any nausea and or vomiting. And just a few words on morphine, which is an opioid pain medication, because I do work in a hospice setting. Morphine is the most common pain medication in the hospice setting. And it is preferred because it's highly effective for most people, and it doesn't only help with pain, but also for shortness of breath, which is why it's used so often. And morphine is also started slow and at low doses, and slowly increase until the desired effect is achieved with minimal or no side effects. And there are no studies to show that morphine causes addiction in the hospice setting, which is important to some folks as well. And morphine, it doesn't necessarily mean that when you start morphine that the end is near. The goal here is just to provide comfort. And so now we'll review some non-pharmacological interventions. We've already discussed some of these, but it's always good to kind of remind yourself what you can do on your own to kind of relieve some of that pain that you may have. So again, some breathing exercises, some deep breathing. So in through the nose, out through the mouth. It helps a lot with stress as well. And a cold washcloth may be a good idea, maybe a gentle massage from your loved one or caregiver. Some music, maybe dimming the room when you're having a migraine can help very, very much. Removing loud noises and distracting yourself. And about the healthcare team, the nurse or caregiver should always be notified of any reports of a new onset of pain, persistent pain, unrelieved pain, or side effects of pain medications. And other members of the healthcare team might also be brought in to address other issues like psychosocial or spiritual distress. For example, a chaplain or spiritual care counselor. And that is it for the basic pain management course. And I just kind of wanted to share some resources I have for you as well. And again, to review of how to make a referral to YOLO Cares. So if you feel like your loved one needs that compassionate, individualized care that aligns with their wishes, please feel free to call our offices to learn more about our services. Or you can visit our website at yolocares.org. That's always a good place to start as well. And if that is something that your loved one may be interested in or that you need, then your physician can start that referral process by filling out that PDF form on that Make a Referral page that we had shown earlier in the presentation. And again, the website is yolocares.org. All right. And thank you so much. And I just wanted to bounce off of the end of life care here, since I am coming from YOLO Cares Hospice, and especially since we are in ACC, where we have a lot of caregivers caring for residents. Caregivers know their residents the best because they are with their residents day in and day out. And so it's important to know how to identify the signs that a patient might need some extra support and to call in that support, which might be a good place to, which is where we would come in as YOLO Cares. And we'll go over the signs here in a little bit. But you can always call us anytime. We'll be able to schedule a time to meet with your patient to determine what that patient may be eligible for. And so some signs to look out for that may indicate that a formal palliative care or hospice evaluation should be considered include unintentional weight loss of 10 pounds or more, cognitive decline mentally or emotionally in the past 3 months, progressive decline despite medical therapies, multiple ER visits in the past 6 months, taking 5 or more medications, maybe they have a decreased appetite, or they have a diagnosis of heart disease, COPD, or cancer, and or Alzheimer's disease or dementia. Or they have an increasing difficulty managing their pain and other symptoms. So if you know that your loved one or your resident has 4 or more signs of this, then that may be a time to call YOLO Cares, to call with any questions that you may have, or visit yolocares.org. And our number here to the direct line is 530-756-5566. And another resource that we have for our caregivers, which are, we're all rooting for the caregivers to learn more. We have some educational resources for end-of-life care. And it's a great resource for your whole team. So we, YOLO Cares Academy, that's what we're called, and we currently offer both in-person workshops that can be scheduled for your whole team, as well as online self-paced certifications. And we do offer CEUs for that online certification program, which is might be a nice thing for your caregivers. And so you would want to reach out to the business development manager at businessdevelopment@yolocares.org to learn more if you're interested in CEUs or more educational resources on end-of-life care. All right, and that's all I have for you today. Thank you so much for having me. And if we have any questions, I guess we can open that up as well. Or if you have any questions, okay.
Can you please repeat the website?
Yes. Yes, YOLOcares.org. So that's
Okay.
YOLOCARES.org.
Okay. Okay, and the phone number, please?
Yes, I need to look at that. So that's 530-756-5566. And our office is actually located in Davis, California. It's not too far away, about 15, 20 minutes. But we serve Yolo, Solano, Colusa, Sacramento, and Sutter counties as well.
Okay, thank you.
Yeah, thank you. Thank you so much for having me. Thanks for the questions.